Ever wonder how doctors like peer inside your heart, to figure out its rhythm and all its
It's
secrets?
really quite remarkable,
But it
actually.
is. It's like they have some kind of magical stethoscope that can hear like the whispers of your heart's electricity rate.
Uh-huh. Yeah.
That magic, my friends, is the electrocardiogram, or what we call the ECG. And it's an invention that like totally revolutionized cardiology. Today, we're doing a deep dive into its fascinating world.
Yeah, and I think people would be surprised by how much info we can get from this, like, simple and painless tool. About the health of your heart, I mean.
Right. To learn about this tech, how it works, and why it's like so important in healthcare.
Well, an ECG basically measures the electrical activity that your heart generates every time it beats.
Oh.
These super tiny electrical signals, they control the rhythm and, like, the coordination of your heartbeats. And by, like, capturing these signals and then, like, analyzing them, we get a window into how your heart's working, you know?
So like, we're talking about actual electricity going through our body.
Yeah, exactly. And it's this electrical activity that the ECG picks up. Like, imagine you're listening to your heart with a super sensitive microphone.
So like, how does that even work? Do we have to get hooked up to like some electrical source or something?
Not at all. That's the cool thing about the ECG. It's totally passive.
Mm.
It just uses these things called electrodes. They're like these small sticky patches that go on your skin.
Okay.
And they detect the heart's own electrical signals. They don't, like, give off any electricity themselves. They just, like, act as sensors.
So it's like those earthquake sensors, right?
Mm.
That can detect vibrations in the ground.
That's a great analogy. So these electrodes pick up the the heart's electrical impulses and send them to the ECG machine, which then, like, turns them into the squiggly lines we see on the readout.
Oh, cool. So why would someone need to have this electrical activity measured? When would a doctor like order an ECG?
Well, ECGs can be used for a lot of different reasons. Like if you're having chest pain, irregular heartbeats, shortness of breath, dizziness, or even if you're just feeling tired all the time. Your doctor might recommend an ECG. It can rule out any, heart problems.
So it's a bit of a detective tool for the heart.
Exactly. It can help diagnose a whole bunch of heart conditions, from arrhythmias, like irregular heart rhythms, to heart attacks, to problems with the heart valves. And we also use them to monitor if heart medications are working, or like to check on your heart's health before surgery.
Wow, that's a lot. So like, when was this amazing invention discovered?
Well, we have a Dutch physician and physiologist to thank for it, Willem Einthoven.
Okay.
Back in 1903, he developed the first, like, practical electrocardiogram.
Oh.
His invention was a major breakthrough in cardiology. Like, he won the Nobel Prize in Physiology or Medicine for it in 1924.
A Nobel Prize.
Yeah.
That's like incredible. So those early machines must have been pretty something, huh?
Oh, yeah. They were huge and clunky.
Huh.
They relied on a system of wires and lights and mirrors to, like, project the heart's electrical signals onto photographic paper.
That's crazy.
Luckily, things have advanced quite a bit since then.
I can only imagine. Okay, so say I go to a clinic today for an ECG. What can I expect? Like, what's the process like?
Well, the first thing to know is it's totally painless and super quick.
Good to know.
The technician will, like, prep you for the test. Like, they'll ask you to take off any jewelry or metal objects because that can mess with the readings. And you'll probably have to take off your shirt or blouse so they can, like, put the electrodes on your chest.
Okay, so I should wear a comfy top that's easy to take off.
Exactly. And then they'll attach the electrodes to your arms and legs and chest using this special conductive gel. It just helps the signal transmit better,
So no lotion or oils beforehand.
Right. And then you just lie still and relax while the ECG machine does its thing. The
Yeah.
recording usually only takes a couple of minutes.
And these electrodes are placed, like, very specifically, I'm guessing.
Yeah. You bet. Each electrode has, like, its own spot, like coordinates on a map.
Right.
They capture the heart's electrical activity from, like, all these different angles.
Hmm.
We call these different viewpoints leads, and a standard ECG uses 12 of them.
12 leads, that's a lot.
It is. 6 are limb leads because they're on your arms and legs.
Okay.
They give us, like, an overview of the heart's electrical activity. So they're labeled I23, AVL, AVR, and AVF.
Okay.
The A means augmented because these leads are actually derived from combos of the first 3.
So it's like having, like, a bunch of cameras taking a panoramic picture.
Exactly. Now, the other 6 leads are called precordial leads. These go on your chest, and they give us like a closer look at the heart's electrical activity.
So limb leads are the big picture, and precordial leads are the close-up.
Precisely. And they're labeled V1, V2, V3, V4, V5, and V6. Each one's placed at a specific intercostal space, which is the space between your ribs.
That placement must be so important for like accurate readings, right?
Yeah, it is. Lead V1, for instance, is placed in the 4th intercostal space, just to the right of your breastbone.
Okay.
V2 is placed in the 4th intercostal space, just to the left of your breastbone. V4 is in the 5th intercostal space at the mid-clavicular line. It's like this imaginary line drawn down from the middle of your clavicle or collarbone.
Wow, it sounds super specific.
It is, and there's even a special placement called right-sided ECG placement.
Okay.
This is where lead V4 is put on the right side of the chest, like a mirror image of its usual spot on the left. This helps us see any problems specifically on the right side of the heart, like a right-sided infarct, which is, a blockage of blood flow.
So each lead has like a specific job to do, capturing the heart's electrical activity.
Exactly. Just like different instruments in an orchestra contribute to the overall sound.
Okay, so now we have 12 leads collecting all this electrical data. But where does this electricity even come from? How does the heart make these signals?
That's a great question. Your heart has its own internal electrical system. It's called the cardiac conduction system. Think of it as like the wiring that keeps the heart beating in sync efficiently.
So like the heart's own internal power grid.
Yes. This system's made up of specialized cells that generate and conduct electrical impulses throughout the heart.
So who are the key players in this electrical orchestra?
The main ones are the SA node, AV node, bundle of His, bundle branches, and Purkinje fibers. Each one's essential to the heart's electrical symphony.
Okay, those are some pretty complex names. Could you break them down for us? Like, what does each part actually do?
Sure. The SA node, it stands for sinoatrial node. It's often called the heart's natural pacemaker.
Okay.
It's this small group of cells located in the upper right chamber of the heart, the right atrium. And the SA node is what starts the electrical impulses that trigger each heartbeat.
So like it's the conductor who sets the tempo for the whole orchestra.
Exactly. And these impulses travel from the SA node through the atria, causing them to contract and pump blood into the ventricles, which are the lower chambers.
So the atria are like the first section of instruments playing their part.
Yes. Then the signal gets to the AV node, or atrioventricular node, and this acts as like a gatekeeper. It slows down the signal for a sec, which lets the ventricles fill up completely with blood before they contract.
Why the pause? Was the point of that?
It's all about timing. That tiny delay makes sure that the ventricles have enough time to fill up with blood before they pump it out to the body.
Okay.
Without that pause, the heart wouldn't be able to work properly.
So like it gives this second section of instruments time to get ready before they jump in.
Exactly. After the AV node, the impulse goes down this path called the bundle of His, which then splits into the left and right bundle branches.
So the signal is branching out, like the melody splitting into different parts.
Precisely. And finally, it gets to the Purkinje fibers, which spread out through the ventricles, making them contract and send that oxygen-rich blood out to the body.
And that's the grand finale. All the instruments playing together.
It truly is. It's this perfectly timed electrical sequence that creates the heartbeat we feel.
That's so cool. So how does this electrical activity actually show up on the ECG? How do we read those squiggly lines?
Ah, yes. The ECG tracing, it's like this secret code that can tell us so much about the health of your heart. But before we can decode it, we need to understand how it's represented. Imagine a grid, like graph paper. Time is on the horizontal axis and voltage is on the vertical axis.
So we're looking at both time and the the strength of the electrical signals.
Right. And as those electrical impulses move through the heart, they create different waveforms on the ECG.
Okay.
These waveforms represent different phases of the heart's electrical cycle. And each wave has a name. The P wave, the QRS complex, the T wave, and sometimes a U wave.
So we're not just looking at random squiggles.
Yeah.
Each one means something specific.
Absolutely. Each wave corresponds to a specific electrical event happening in the heart.
That's wild. So let's break it down. What do all these P's and Q's and R's and S's and T's actually tell us?
Okay, so the first little bump you see is the P wave. It represents atrial depolarization.
Hmm.
That's when the atria are electrically activated, getting ready to contract.
So the P wave is like the atria's moment.
Right. Then you've got the QRS complex, that's a much bigger spike. This one represents ventricular depolarization.
Okay.
That's when the ventricles are activated, making them contract and pump out blood.
So that's the ventricles taking center stage.
Exactly. After the QRS complex, you'll see the T wave, which represents ventricular repolarization.
Hmm.
The ventricles are relaxing and getting ready for the next beat.
So the T wave is like the orchestra taking a breath before the next part of the music.
That's a great way to put it. And then sometimes you see a U wave. It's not always there, but it's thought to represent the recovery of the Purkinje fibers.
So we've got the P wave for the atria, the QRS complex for the ventricles contracting, and the T wave for the ventricles relaxing. What a dance. And this all happens in like less than a second, right?
Yeah, it's remarkable, isn't it? The heart's electrical system is so fast and precise, and the fact that we can capture it all with the ECG is even more amazing.
I know, it's crazy. But how do doctors actually know what they're looking at? Like, what tells them if a heart is healthy or not?
Well, there's a system to how we read an ECG. It's kind of like a detective following clues. We look at each part of the tracing, looking for patterns, any changes, anything that seems off. And that can point to a heart condition.
So it's not just about looking at the squiggles. There's a science to it.
Absolutely. There are 8 key steps to interpreting an ECG. And each step gives us clues about the heart's health and how well it's working.
Okay, I'm ready to learn how to be an ECG detective.
Great. The first step is figuring out the rhythm, checking if the heartbeats are regular or irregular.
So like listening for a steady beat in the music.
Exactly. We want to see if the space between the heartbeats is consistent. If they are, then the rhythm is regular. If not, then it's irregular.
Okay, so regular is good. What's the next clue we look for?
Step 2 is checking the rate, basically how fast or slow the heart is beating. We can figure this out from the ECG tracing using a few different ways.
So we can actually see the heart rate on the ECG.
Yes. One way is to count how many QRS complexes there are over a 6-second interval and then multiply that number by 10.
So like if we see 7 QRS complexes in 6 seconds, that means a heart rate of 70 beats per minute.
Exactly. There are other methods too, like counting the little squares between 2 R waves and dividing 1500 by that number.
So different ways to measure the heart's tempo.
Right. And it's important to remember that some variation in heart rate is normal. Like sinus tachycardia means the heart rate is faster than 100 beats per minute, and sinus bradycardia means it's slower than 60. These can be totally fine, especially during exercise or when you're sleeping.
Okay, so faster doesn't always mean something's wrong. What's the next step in our investigation?
Step 3 is looking at the P wave, that little bump that shows atrial depolarization.
Right, the atria.
We want to make sure it's there and that it looks normal. Anything weird about the P wave can mean there are problems with how the atria are working.
So checking on the atria, making sure they're doing their part. What comes after that?
Then we look at the PR interval. That short pause we talked about earlier, that lets the ventricles fill up with blood.
Right.
This interval is measured from the start of the P wave to the start of the QRS complex.
So we're measuring how long it takes for the signal to go from the SA node to the AV node.
Exactly. The normal PR interval should be between 0.12 and 0.2 paraseconds. If it's shorter or longer, it could mean a problem with the pathway between the atria and ventricles.
Okay, so that little pause is super important. What's next?
Step 5 is all about the QRS complex. Remember, that's the big spike that represents ventricular depolarization.
Right.
We look at its shape, how long it lasts, and anything unusual. Those things can indicate problems with how the ventricles are working.
So making sure the ventricles are pumping like they should.
Precisely. A normal QRS complex should be narrow and pointy, lasting no more than 0.12 seconds. If it's wider or distorted, it could mean a problem with the electrical conduction in the ventricles.
Okay, so we've checked the rhythm, the rate, the P wave, the PR interval, and the QRS complex. What else do we look at?
Step 6 is all about the T waves, which, you remember, represents ventricular repolarization.
Yeah.
We check its shape, direction, and any abnormalities, because these can mean problems with how the ventricles are recovering after each contraction.
So making sure they're getting enough rest before the next beat.
Exactly. A normal T wave is usually upright in most leads, but it can be inverted in some. Any big changes in its shape or direction can indicate problems with the heart muscle or with the balance of electrolytes in the body.
Wow, so even small changes in the T wave can be a big deal. What's next?
Step 7 is looking at the QT interval. This represents the total time for ventricular activity, from the start of depolarization to the end of repolarization.
Hmm.
We measure it from the beginning of the QRS complex to the end of the T wave.
So like we're measuring the entire ventricular performance
Hmm.
from contraction to relaxation.
Exactly. Now, the normal QT interval varies depending on the heart rate, but a prolonged QT interval can be dangerous.
Why is that? What makes it so dangerous?
Well, a prolonged QT interval means the ventricles are taking longer to repolarize, to recover.
Mm-hmm.
And that can increase the risk of dangerous heart rhythms, like torsades de pointe. It can be life-threatening.
So even a small delay can have serious consequences.
Yes, it can. That's why monitoring the QT interval is so important, especially for people taking meds that can prolong it.
Okay, so we've looked at the rhythm, the rate, the P wave, the PR interval, the QRS complex, the T wave, and the QT interval. What's the last step in our ECG investigation?
The eighth and final step is the ST segment. This is the flat line that connects the QRS complex and the T wave. It represents the early part of ventricular repolarization.
So like the ventricles getting ready to relax.
Exactly. Usually the ST segment should be at the same level as the baseline, meaning it's flat.
Okay.
But any elevation or depression of the ST segment can be a sign of a serious problem, like an acute myocardial infarction.
The heart attack.
Right.
So flat is good, and any dips or spikes could mean trouble.
Exactly. So looking closely at the ST segment is really important. It can literally save lives.
Wow, who knew that those squiggly lines could tell us so much?
It's a testament to the ingenuity of those who developed this technology and the healthcare professionals who use it every day to diagnose and treat heart conditions.
I know, I feel like I've learned so much already. But before we dive into specific heart conditions, I think it's time for a quick break.
It really is amazing what we can learn from a simple ECG. It's like we can see how the heart's talking to itself.
It's mind-blowing. Those squiggly lines, they're like a whole language now. We can see the heart's secrets. And I feel like we've just, started to learn about them.
Right. There's a lot more to learn. Remember those 12 leads? They each give us like a different view of what's going on electrically in the heart.
Like multiple cameras at a big event.
Right, exactly. And this is so important when we're trying to, find specific abnormalities. So, for example, certain patterns of ST segment elevation or depression in particular leads that can show us where a coronary artery might be blocked.
Oh, wow. So it's not just about the overall shape of the ST segment, but also which leads are showing those abnormalities.
Exactly. Where those ST segment changes are, that can help us see exactly what part of the heart isn't getting enough blood. It's like, imagine you have a map of the heart's electrical system, and you can just zoom right in on the problem area.
That's wild. So all those 12 leads, they aren't just there for looks. They're really helping us understand all the electrical stuff going on in the heart.
Absolutely. They're crucial for getting the right diagnosis. There are tons of other patterns and variations in the ECG that can point to different heart conditions, from arrhythmias to valve issues to an enlarged heart.
It's like learning a whole new language. Every little change in the ECG is telling a different story. So this might be a bit of a sidetrack, but I'm curious, what can mess up these ECG recordings? I mean, we talked about getting those leads in the right spots, but are there other things that can affect it?
Yeah, for sure. Patient movement is a big one. Any muscle activity, even small movements, that can cause electrical interference, and that'll show up as artifacts on the ECG.
So people really have to lie still during the recording?
Yeah, it's important. Sometimes even breathing can cause artifacts. So the technician might ask the person to hold their breath for a few seconds during parts of the recording.
I never realized it was so sensitive. What about stuff in the room, other electrical equipment? Could that cause interference?
Oh, yeah, definitely. That's why we do ECGs in a quiet room, away from anything electrical that can create noise.
So it's got to be a really controlled environment to get a good picture of the heart's electrical activity.
Exactly. And that goes for the skin, too. It has to be prepped properly before we put on the electrodes.
Clean and dry, right?
Yes, but it's more than that. Oily skin or lotions can mess with the contact, so we have to clean the skin with alcohol wipes first.
So we're clearing the path for the signals.
Exactly. And if someone's really hairy, we might have to shave or trim the hair where the electrodes go. We have to make sure they're making good contact.
Makes sense. So all this stuff patient movement and noise and skin prep, it can really change the quality of the recording. and maybe even hide important details.
That's right. It's all about the details. Both for the technician doing the ECG and the patient taking the test, every step is important. From prepping the patient to analyzing the tracing, it all has to be right for the results to be accurate.
Okay. We've been, like, focusing on the technical parts of ECGs, but I'm also thinking about, the people getting these tests done. What's it like for someone getting their first ECG? It seems kind of personal.
That's a good point. For a lot of people, it's no big deal, like routine. But for some, yeah, it can make them anxious, especially if they're already having symptoms that led to the ECG in the first place.
I can see that lying there with wires hooked up to you. It's got to feel a little, I don't know, vulnerable.
It can. That's why it's so important for us to be aware of that, and reassure people. Communication is key. Explaining the procedure beforehand, answering their questions, and just creating a calm environment. That can help a lot.
And reminding them that it doesn't hurt, right?
Exactly. The electrodes don't, like, shock you or anything. They're just listening.
Okay, that's good to know. So once they're done, what happens next? How long does it take to get the results?
That depends. In an emergency, we can interpret an ECG right away to help, decide how to treat someone.
So it's like a really fast way to figure out what's going on.
It is. But in a non-emergency situation, the tracing is usually looked at by a cardiologist who then writes up a report for the referring doctor.
So it could take a few days to get the full interpretation?
It could, yeah. And sometimes we need to do more testing depending on what the ECG shows. Often the ECG is just, the first step.
It's a piece of the puzzle, right?
Right. It gives us key info about the heart's electrical activity. But then we look at that alongside the patient's medical history, their symptoms, and other tests. That's how we figure out what's going on and how to treat it.
Makes sense. So we talked a lot about Einthoven's invention, but have there been any big advancements in ECG tech recently?
Oh yeah, there have been some really cool developments. One is in ambulatory ECG monitoring. This is where a patient wears a portable device that records their heart rhythm for a longer time, like 24 or 48 hours.
So it's like keeping an eye on your heart all the time.
That's a great way to put it. This is really helpful for catching those irregular rhythms that, might not show up during a regular ECG.
Like those little flutters that come and go.
Right. And another big area of innovation is in artificial intelligence, or AI.
Oh, wow. I mean, AI is everywhere these days, so I guess it makes sense that it's being used in cardiology too. How does it work with ECGs?
Well, researchers are using AI to create algorithms that can, like, automatically look at ECGs and find anything abnormal. It's almost like having, a digital cardiologist on call, checking those squiggly lines all the time.
So AI is helping us read the ECGs faster.
Exactly. And these systems have the potential to make diagnosis more accurate and efficient, especially in places where, it's hard to find a cardiologist.
That's amazing. So it's like making expert analysis available to more people. Are there other ways tech is changing the ECG world?
Yeah, definitely. Telemedicine is another big one. It lets patients in remote areas, have their heart rhythm checked by specialists who are far away.
It's like breaking down those geographical barriers, right?
Yeah.
To healthcare.
It is. These are just a few examples. Tech is constantly evolving, so we can expect to see even more innovations in ECG tech, which will lead to, finding problems earlier, getting more accurate diagnoses, and treating heart problems more effectively.
That's so exciting. So in this deep dive, we've talked about a lot, from how the ECG is recorded to the different parts of the tracing to how we interpret it. And we talked about how important it is to get those leads in the right spot, to prep the patient right, and to do it in the right environment.
Right. And we've also seen how technology is changing things, like ambulatory monitoring, AI, and telemedicine.
It's amazing. But before we wrap up, I want to bring you back to the heart itself. It's easy to get, lost in the tech stuff and forget that we're talking about, like, a vital organ, something that keeps us alive.
That's a really important point. We can get so focused on the tools that we forget about the, beating heart that we're actually trying to help.
Right. So, like, what can the ECG really tell us about, the overall health of the heart?
Well, it can tell us a lot about the heart's rhythm and rate and how well the electrical signals are moving. And it can also show us signs of, like, damage to the heart, like from a past heart attack, or stress on the heart, like from high blood pressure.
So it's like looking back in time
Yeah.
and also seeing the current state of the heart.
Yeah, exactly. But we have to remember that the ECG, it's just one piece of information.
Right.
We have to look at it alongside everything else, the patient's history, their symptoms, other tests. Exactly. It's not a magic bullet. It's part of a bigger picture. But when we use it right, the ECG is a powerful tool for keeping hearts healthy.
I'm really starting to understand why the ECG is so important in cardiology. It's so simple, but so powerful. It's really changed how we think about the heart.
It has. And because of technology, it's getting better all the time, helping us unlock even more of the heart's secrets.
It's an amazing time to be like learning about all this. It's amazing to think about all the possibilities for the future. So like, what can we expect in the next few years in terms of ECG technology, I mean?
Well, wearable tech has a ton of potential. I mean, we already have smartwatches and fitness trackers that can record your heart rate. And some can even detect certain arrhythmias, those, irregular heartbeats.
It's like you could have an ECG on your wrist.
Yeah, exactly. And as this stuff gets, even more advanced and connects with healthcare systems better, it could totally change how we, keep tabs on our hearts.
Imagine if you could see like tiny changes in your heart rhythm before you even felt anything. That could be like life-saving.
It could. Finding problems early is so important for preventing serious stuff. With wearable tech, I think we're heading toward a future where, everyone's heart is being monitored all the time.
That's incredible. What about AI? How will that change things for ECGs?
Well, it's already being used to, analyze ECGs automatically, and that's only going to get bigger. We'll see even more advanced algorithms that can not only find, abnormalities, but also predict future heart problems, like heart attacks or strokes.
So AI is going to be like a crystal ball for our hearts.
Kinda, yeah. AI can look at huge amounts of data and find patterns that we might miss. And that could help us, take action earlier, maybe even stop those heart problems from happening in the first place.
Wow, that's really amazing. So it seems like cardiology is moving toward like personalized care that's more proactive.
It is, and ECGs are going to be a big part of that by providing the data we need to make all this progress.
This deep dive has been so interesting. It's wild to think that under the surface, in our everyday life, our heart has this like whole electrical symphony going on.
It is. It reminds us that the heart's not just a muscle. It's this complex electrical organ.
And with every beat, there's a story.
Yeah.
And ECGs can help us, read that story, understand it.
Yeah, that's a good way to put it.
Well, I want to say a huge thank you to the London Heartbeat Z Academy for all their support and educational resources.
Yeah.
This deep dive wouldn't have been possible without them.
They're a great resource for sure for anyone who wants to learn more about, the heart.
Totally. And to our listeners, if you're interested, check out their website. They have like over 150 courses on all sorts of cardiology stuff. And make sure to follow them on social media for like free updates and more cool discussions like this one. They're on Facebook, Instagram, Spotify, and YouTube.
You won't want to miss what they do next.
Yeah. Okay. That's it for this deep dive. Keep your hearts healthy, everyone. And remember to listen to that amazing electrical symphony.